Hey everyone, welcome back to Monthly Mastery Week 3. This week's focus is clinical evidence, how it's generated, how to read an article, and then how to leverage the article in a clinical conversation. The learning objectives for today are: we will learn the different levels of evidence and how data from each level is used in the decision-making process. All innovation and disruptive technology navigate a similar adoption pathway. Innovators like Dr. Oliviers and Shada see the value in a new technology and develop reproducible workflows. The next step for a new technology to cross the chasm is to prove clinical superiority or demonstrates clinical equivalence with significant secondary benefits. For example, when comparing an open prostatectomy to a robotic prostatectomy, the oncologic outcomes are the same. However, robotic prostatectomy brings significant downstream benefits like reduced length of stay, reduced complication rates, increased sexual function, the list goes on and on. As Focal One HIFU becomes more and more accepted within the urologic oncology community, our next group of adopters will require more clinical evidence that compels them into action. Let's start with the basics. Generally speaking, there are two main types of academic research data: qualitative and quantitative. Qualitative is based more on experiences or feelings. For example, polling people on how they feel on a particular issue or studying how patients felt after a particular treatment alone. Quantitative studies are based more on hard data, such as looking at a patient's blood pressure before and after treatment. Levels of evidence, sometimes called hierarchy of evidence, are assigned to studies based on the methodological quality of their design, validity, and applicability to patient care. These decisions gives the grade, or strength, of recommendation. The levels of evidence pyramid provides a way to visualize both the quality of evidence and the amount of evidence available. For example, systematic reviews are at the top of the pyramid, meaning they are both the highest level of evidence and the least common. As you go down the pyramid, the amount of evidence will increase as the quality of the evidence decreases. The pyramid is also split between filtered and unfiltered evidence. Filtered and unfiltered resources differ in the level of evaluation applied to the works reviewed and the transparency of the authors regarding their evaluation methods, criteria for inclusion,